Why the use of AI in healthcare is essential to boosting mental health and wellness. First, how big is the market segment for mental health and wellness that focuses on the well-being of employees? The global market for mental health, according to Allied Market Research, was worth more than $383 billion in 2020 and is anticipated to approach $550 billion by 2030. This market segment is distinguished by the lack of a pleasant emotion, having a bad mood, and a variety of related cognitive, physical, emotional, or behavioral symptoms. 1 in 5 people in an organization is affected by these conditions. What is the main problem with mental health? The main factor raising the risk of disease is depression, which is the leading cause of disability worldwide. The rise in anxiety and depression is what worries me the most. According to the World Health Organization, WHO, depression affects 4% of people worldwide. It's intriguing that the United States is the world's most depressed nation. The global pandemic has led to an increase of over 25% in the prevalence of depression and rising anxiety, topping these realities. According to Dr. Tedros Adhanom Ghebreyesus of the WHO, the information we currently have about the impact of COVID-19 on the world's mental health is just the tip of the iceberg. This is a wake-up call for all nations to pay more attention to mental health and to better support the mental health of their populations. What symptoms indicate depression? According to the Diagnostic and Statistical Manual of Mental Disorders, a major depressive episode includes at least 5 additional symptoms, including a depressed mood for at least 2 weeks, a loss of interest or pleasure in almost all activities, and issues with sleep almost always, either difficulty sleeping or sleeping too much. A decrease or increase in appetite nearly every day, changes in appetite and weight, change of more than 5% body weight in a month. Almost daily decreased energy or fatigue. Inability to focus, make decisions, or think clearly. Recurrent thoughts of death or suicide, a suicide attempt, or a specific plan for suicide, as well as psychomotor agitation or retardation that is visible to others, slow physical movements, unintentional, or pointless motions. Managing mental health in the boardroom. In 2020, governments worldwide allocated just over 2% of their health budgets to mental health, according to the WHO's most recent mental health report, and many low-income nations reported having fewer than 1 mental health worker for every 100,000 citizens. This is obviously insufficient. Due to the Great Resignation, which began in North America during COVID and has since continued to have an impact on and upend global supply chains. Many of these employees are quitting their jobs for reasons other than pay or the job itself, which continues to be a major problem in leadership. Finding ways to recognize these risks early is a boardroom issue because unhappy people are 4 times more likely to experience depression. 2/5 of people, according to McKinsey research, are dissatisfied with their jobs and are thinking about quitting in the near future. The chaos in operations and difficulty in finding talent is hurting operations greatly because many of these resources are also leaving their industry. Board members and all C-level executives should therefore give their attention to mental health and wellness more serious consideration. To control the tides and reduce the likelihood of being hit by a tsunami, attention must be paid to this serious issue on a daily basis. Key details. According to statistics, employees are still quitting their jobs or are at least thinking about doing so. In June, more than 4 million Americans left their jobs. The U.S. Bureau of Labor Statistics reports that there are currently over 11 million open positions. In Japan, there are 1.27 times as many open positions as there are applications. For the first time in records, there are more open positions in the UK than there are unemployed people. Additionally, in the EU, there are on average just under 3% of open positions. The benefits of AI solutions for healthcare needs. Patients in mental health care are becoming more and more interested in AI. By gathering feedback, making personalized recommendations, delivering the right content, acting as a surrogate companion, and making sure employee voices are being heard and that their insights can help solve systemic work conditions, AI can be used to not only detect depression risks but also to treat depression with tools to manage depression symptoms. Security and access. An AI app can give a worker a safe place to express their emotions and the ability to track their moods as a clue to leading a healthier life. Additionally, it can offer suggestions on how to enhance organizational working procedures and bring up issues involving abuse, inappropriate leadership, diverse and inclusive behaviors, or sexual harassment. When operating in a safe environment, AI can create a place where people can express their emotions, vent, and feel secure knowing that the information they provide about their experiences is completely anonymous. AI apps can also be accessible to your staff members 24/7, 365 days per year. Most mental health apps offer quick access to resources anywhere that support a variety of resources, including mobile devices, laptops, etc. Complete comfort at your discretion. Observable mood patterns. As the employee uses the app more frequently, AI models can learn more not just about the user but also about all users and develop statistical patterns on happiness risks, assisting management in anticipating future risks or hastening the mitigation of present risks. The more data that is aggregated privately, the more overlay patterns can be created in fields like email science and natural language processing, which examines email or voice discourse over time and highlights language shifts in employee or team communication. If shifts are detected, AI can then provide guidance to the specific employee while maintaining anonymity. Any way AI is used, emphasis on anonymity and privacy must be carefully considered before choosing any AI software tool with a health and wellness focus. Relevancy of AI content. AI-based depression resources can be beneficial to management and peers as well, preventing employees from bringing up talent when it needs support due to fears, guilt, or shame. For instance, if a mood AI app notices that you have been depressed for 7 or more days, the app may send the user some interesting resources without informing anyone else besides the person who may be in need. Combined insights can help management understand what new resources are needed to support emerging trends in the data. The development of an AI content strategy can also be guided by natural language processing, NLP, analysis of all verbatims. Having a connection pal who always loves you gives you a feeling of belonging. The ability to consult a private counselor in today's rapidly evolving world is becoming more and more challenging. In many cases, interacting with an app that guides you to relevant content and prompts ideas you can act on privately while asking you questions about how you are feeling can be a very cost-effective substitute for private counselors. Private apps can create a safe environment for discussing difficult situations and expressing emotions. Being able to forge a connection and feel listened to genuinely is part of the healing process for depression. AI can also advise on what people to speak to when certain situations arise and source the relevant experts or content that they would not easily find in a large organization. Conclusion. As a result, AI private software solutions with strong diagnostic and support systems to monitor mood and happiness will increasingly become as common as the office water cooler or, with today's employees working from home, perhaps the ease of access to a smartphone. AI in healthcare will continue to create new solutions that are not only relevant, timely, private, and secure, but also give access to many underserved populations who cannot access or afford counseling support services. It is evident that board members and C-suite executives must recognize the importance of happiness because depression and sadness are on the rise. New mental health and wellness toolkits will be required, many of which will have a strong emphasis on mood and many of which will make use of cutting-edge AI methods for more robust and intelligent sense-making.